Is sponsored by Holland Hospital. Today marks the beginning of American Heart Month, a time to raise awareness about heart disease. Dr. William Frauenheim is here with us this morning to kind of talk about heart health, what that all means. Good morning.
Yeah, good morning.
Okay, so first let's start off. What exactly is heart disease?
Well, Brittany, heart disease, it's really a pretty broad term, but I think most of the time when we talk about heart disease, we're talking about hardening of the arteries that supply the heart. So the heart's a muscle. It's about the size of both of your fists combined, and it works hard. It's beating 100,000 times, 100,000 times a minute.
Wow!
And over. It needs its own fuel that it gets through these three blood vessels, these arteries, and when these arteries clog up, that's what we're talking about with heart disease.
Okay. Now, obviously, that's a problem. We don't want a heart disease. Talk a little bit about maybe some risk factors or people that are more prone to heart disease.
Right, well that's a really good question because people should know their risk, and you can know your risk. There's major risk factors for heart disease, and that includes things like high blood pressure, diabetes, high cholesterol, cigarette smoking, family history, and age. But it's hard to just count the number of risk factors and know your risk, so we put all those risk factors into an equation, and we can actually calculate your risk of developing a heart attack or stroke in 10 years and give it a number.
Wow.
So if that number is 10% to 20%, that's considered intermediate risk. Above 20%, that's high risk, and that risk depends or determines how we treat you in some circumstances.
Okay, man, that's crazy. I did not realize that. And then when it comes to, I think one of the things we also hear a lot about when it comes to the heart is heart attack. Now, what are some of the signs or symptoms of a heart attack?
Right. Well, let me just say a heart attack, just so people know exactly what we're talking about, is when one of those blood vessels to the heart closes off. And then there's no blood getting to that part of the heart. And whatever part of the heart that blood vessel supplies, then it will die. Now, if you can recognize the symptoms, it takes about 2 hours for heart damage, permanent heart damage to occur. So if you can recognize the symptoms and come in, we can open that artery within 60 minutes, so we can prevent a heart attack. So after it happens. So the key symptoms, there's 3 major symptoms. The classic is a tightness in the chest. It's very diffuse. You cannot put your finger on it. It's not localized. And it can extend into the shoulder, into the neck. It's a squeezing sensation. And we say pain, but a lot of patients don't say pain. They say it's tight.
It's tight.
It's heavy. And then other symptoms with it can be shortness of breath, nausea, and in some people, like women for example, or diabetics, they might not get classic symptoms. They might get more atypical symptoms. It might be as simple as indigestion. But what we're always trying to convince people is if you have a new feeling like that in your chest, let us figure it out.
Better safe than sorry, for sure. And then what about, this seems like a silly question, but is it too late to start taking care of my heart? Is it too late to start making changes?
Right. Well, it's never too late. But probably the better way to look at it is it's never too early. Because we can have a tremendous effect on our risk of heart disease through our lifestyle and how we live. So 80% of heart attacks and that type of heart disease is lifestyle related. And so I think a lot of this is common sense. People know this, but there are 3 major lifestyle behaviors that will help prevent heart disease.
Yeah, well, and I know eating is one of them, and you're going to be talking about that coming up at a lecture series, correct?
Right, so eating is a huge one, and in this country we have really kind of screwed up diet over the years. We've screwed up dietary advice. We recommended these low-fat, high-carbohydrate diets that the population kind of got heavy on, and what we're going to talk about in my lecture is how to really eat to prevent heart disease.
Wonderful. You can get more info about that upcoming lecture.